Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Amy Patel with us today. Hi, Dr. Patel.
Hello.
I'm so happy you're in our book and we're going to get to know you here. Can you tell us a little bit about yourself?
Yes, I'm so glad to be here. So, my name is Dr. Amy Patel, and I have a story in which my lifestyle medicine journey kind of comes full circle. So, I am a physician, board certified in internal medicine, pediatrics, and lifestyle medicine. I've been interested in health and healthcare delivery and social determinants of health and health disparities from a really young age. I didn't have that terminology when I was a teenager, but I have that now. And I've really been interested in ways in which we can make everybody healthier using everyday techniques. And so lifestyle medicine has been a way that I've been able to do that and do that in a way that I can incorporate into my job currently, which is I work in a 9 through 12 school setting. I think that's actually one of the most impactful ways that we can help people develop healthy habits is to be able to teach them about how to take care of themselves and others, the importance of that from a young age. And I think adolescence is a really prime age for that.
Your work that you're doing is so important. I know the children, kids are your primary focus. Tell us a little bit more about how you first found lifestyle medicine, or it found you, or has it always been a part of your life? And now, how do you use it in your practice?
Yeah, I think my story might be a familiar one and one that others have shared. I had really high aspirations for what I thought it would be like to be a physician and the impact that I could have just by being a physician, trained, caring. And I found that there were many more aspects to practicing medicine and delivering quality healthcare that were beyond my control. And I found myself very early on in my career getting to a point of almost burnout and feeling like what I wanted to do to take care of patients was not actually practical or possible in the current healthcare system. I found a conference at Harvard Medical School on lifestyle medicine several years ago, and it in the description it actually was everything that I ever thought that delivering high quality healthcare was. And so I decided to go. And over the course of those hours and days, I just really felt like I reconnected with my people. These were individuals consisting of other physicians, but also other members of the multidisciplinary care team. And we learned so much about the ways in which healthcare could be delivered in exactly the way that I thought I was going to be. I just didn't realize that it was a subspecialty of medicine until going to that conference. I then stayed connected with lifestyle medicine, learned about board certification, continued to go to conferences to read everything. I've met some really incredible mentors in the field. And it is something that I'm excited to say I not only have incorporated into my practice of medicine, but also it really gives me a framework for how I live my own life.
What have you found the most surprising about when you're teaching children about lifestyle medicine, or what do they gravitate towards when you share your knowledge with them?
It's interesting. I think that our young people have seen the way that healthcare delivery has become. Which is that there is a desire to have kind of a quick fix. You go to see your healthcare provider, your doctor, and you usually get something. And there's a lot of education involved to be able to share that sometimes the best thing you can do is to get more sleep, to manage your stress, keep those cortisol levels down, consider what you're putting into your body, improve social connections, that it's not just, I went to the doctor, they said that nothing was wrong with me, and they told me to sleep some more, that actually there is a lot of science and data, decades of research that talk about how that is better than any type of medicine that I can prescribe for most situations. And so has been surprising is I think young people don't necessarily know that, and they're sponges. They're really easily redirectable and teachable. And so when I offer the science behind the recommendations and just even a couple minutes of additional details, they really get it. And so I feel like that's a way that it can help them to be able to see that, if they can proactively integrate lifestyle medicine practices into their everyday, they can be healthier, but they can also use that when they're sick, when they need to kind of rebalance. They can use those same techniques. It's inspiring.
Amazing. So tell me, pretend I'm a ninth grader.
I have a ninth grader. Actually, I have a 10th grader. So this is really easy for me to be able to, sort of share. So, if somebody were, I'm going to use my own rising 10th grader as an example. So, when he gets sick, when he gets a cold, of course, we'll make sure that, everything is in order, that there's nothing that's, that I can treat with an antibiotic. Most of the time it's going to be a virus. And then we'll talk about the principles of lifestyle medicine. I won't frame it in that way. Of course, I'll make it age appropriate, but being able to give kind of a prescription for what he needs to do in order to get healthy again. I actually really also start with trying to figure out what somebody's goal is. And so whether it's because they're coming in for an illness or they're coming in because they have had a situation with a peer or they're not sleeping well, I don't want to assume that my goal for them is their goal. And so I start by asking what their goal is. And it actually gets them, thinking a little bit more about it. Sometimes they'll say, what do you mean? My goal is to be able to sleep better. That's obvious. But when we get into more specific conversation about it, right, to create a SMART goal about what they want, it becomes clearer. So it becomes clearer to them as to how these different components can be helpful in supporting their goal. They also take more ownership over their health and being able to accomplish that goal. And then creating sort of smaller goals within that larger goal and being able to celebrate those small wins has been really helpful, not only with my own 10th grader, but also with other students that I've worked with.
That's great. I'm an ophthalmologist, so for me, I'm always just telling people what they need to do based on my exam. So I don't interact with patients the way you do, and I love it. I love this model, the coaching model that you've integrated with lifestyle medicine and your coaching background. Okay, let's shift gears a little bit to the book, How Healers Heal. Thank you for being part of the book. Why do you think doctors, non-doctors, patients, kids, why do you think anyone should read this book?
This book applies to everybody, regardless of gender, regardless of specialty, regardless of, profession, even in a non-medical way. So first of all, I think that it really humanizes the experience of healthcare. There are some really impactful stories that are being shared from the heart. And, I think give a glimpse into how absolutely loving and caring and aspirational physicians are in the work that they do and in their hopes and goals and wishes for patients and health outcomes. In addition, the knowledge that is imparted through the chapters, through various explanations throughout the book, through the accompanying workbook, really give a clear way for individuals to be able to reverse or prevent the majority of chronic health conditions that we're all going to be impacted by in some way, whether it's in our own lives personally or in a loved one or a friend. So there are so many nuggets of information within this book. And again, I really think it comes back to being able to impart the knowledge, but also being able to see that there's incredible heart and incredible brains behind that knowledge.
I love how you phrase that. I want everyone to read your chapter, of course. So I think we already talked about my next question, but if you have anything else to add to it, what is your number one tip for lifestyle changes? But I think you already said to find the patient's, motivation and get like what they want. And anything to add to that?
I think that summarizes it. So in my integration of being a physician as well as a coach, that's been really important. That, you know, in both of these fields, it's important to listen to your client, to your patient, and to be able to really seek to understand before diving into a solution. Oftentimes we want to be able to just sort of listen quickly and then fix and then move on in life. And I think to slow it down and to be able to really seek to understand before then problem solving and creating goals and support structures for the client and or the patient.
Is there anything else you want to share? I know we could talk probably for hours about all of your wisdom, but anything else you want to share? And thank you so much for your time today. And how can we connect with you as well?
Yeah, thank you. So I have included some of my social media links within my book chapter. So absolutely feel free to reach out or send me a message. And I would love to connect with anybody, even if it's just to be able to learn more about how lifestyle medicine can be helpful, being able to connect with somebody who might be the most appropriate person for somebody to connect with about their own health, or, you know, even thinking about, you know, things that are a more sort of organizational level. I'm happy to be able to be a source of support and, you know, connection for other folks.
And you're a speaker as well, is that correct? So you can come speak to different organizations about lifestyle medicine and coaching and what you do?
Yeah, absolutely. I absolutely enjoy being able to share information with smaller groups, larger groups. Again, the more that we can spread some of this pretty practical and kind of easy to, you know, easy to be able to share with others, the more that we can do that, the healthier that we're all going to be. And ultimately, that's my goal, is to be able to help each individual feel empowered to be their own best health advocate, but also to be able to take care of other people in their charge. That's my goal. And so I'm happy to be able to do any type of intervention, meetings, conversations to ensure that we can spread that message broadly.
Beautiful. Thank you so much for your time, Dr. Patel.
Thank you so much. Bye.